Good evening and welcome to the second of two Inside Government shows that are being put on tonight by KU Community College for their spring 2020 semester. This is a show that's broadcast on Spectrum, Verizon, Fios, the Auburn Regional Media Access, better known as ARMA, as well as WIN 89.1, the college's radio station. I'm your host, Guy Cosentino. Last fall, we had a discussion about Auburn Community Hospital and KU County's health department's Healthy Mom, Healthy Baby, Healthy Community campaign. With one of our guests in the studio today, Kathleen Cuddy, the KU County Health Department's Public Health Director. That has led us to think about a series of shows this semester to talk about public health issues. I guess it was last month, but a couple of weeks ago, we dealt with communicable diseases, specifically hepatitis A. We talked a little bit about the coronavirus, as well as the flu season that was come on as well. We hope to have a discussion about lead locally and how that is impacting families and children especially. But tonight we're going to have in the studio a discussion about the Women, Infants, and Children program, better known as WIC. We have Tanya Young, who is the County Women's, Infants, and Children's WIC program coordinator, and WIC program nutritionist Stacy Carter, and they're going to be all on talking about this. Welcome, all three of you. Welcome back.
Thanks for having us.
So we're also going to talk about coronavirus because you seem to be the point person for everybody. I see you almost got an invitation out there to attend another meeting. How many meetings have you had on the coronavirus in the last 3 weeks?
Numerous. In person, maybe half a dozen, but telephone calls every day,
Everywhere.
Constantly.
So are there any coronavirus 19 cases in KU County as of today?
As of when I'm speaking to you today, there are 0 confirmed cases of coronavirus.
You do have at least, or maybe just 2 self-quarantined individuals, correct?
So yesterday it was 2, today it's more.
Okay. So what does, first of all, what does self-quarantine mean?
So in this situation, if someone, in all the situations we have actually, has been traveling within the last 14 days to one of the countries of greatest risk as identified through the CDC website, then people are being asked to self-quarantine and monitor themselves and their health as a precautionary measure.
And that means staying at home, that means staying away from other people in their home?
Correct. We are asking them to stay 6 feet away from anyone else who may be in the same dwelling. Ideally, stay in their own room with own use of their own bathroom.
And so I think I know one of the individuals. I know that's a student coming in from, who's on are most of these students who are coming back from students abroad programs?
So it's about half. We've got half who were students and another half of families who were away.
Okay. And so what does the county health department, what's your involvement in those who are self-quarantined?
Our job is to stay in touch with those individuals.
So you're not placing a guard outside their house?
We're not. We are so fortunate that the people involved really understand their purpose, and they truly self-reported to identify themselves for having traveled in these areas. So they want to do the right thing, and they are doing the right thing, which is wonderful. So our job as a public health department is to make sure they have an adequate place to stay, as well as any of their household members, and then to talk with them on a daily basis at least once to make sure they're feeling okay, to see how they're doing. It can be isolating when you're home by yourself.
So are you sending somebody over there, though, to take temperatures, take blood samples, any of that?
Not in this situation.
Okay.
These are people who have no symptoms of illness, so they are telling us how they feel every day. So we might visit them and talk to them through their window on the cell phone, or we might FaceTime with them. We have a few options available to us.
Right. So what happens if somebody lives in a house and let's just say they have a lot of, large family and they just cannot self-quarantine where it makes sense? What steps does the county help them take versus make them take?
So it's the obligation then of the county health department to identify a place where that person can stay and be safely and adequately quarantined, or let that person stay there and find a safe place for that family members to safely quarantine.
And you're not at that stage yet?
We fortunately have not had that instance.
So how many self-quarantines do you think you have now?
I just left a meeting and there are 7 people.
So I know that in the downstate area, I know they're taking over an old community, not a community college, an old college, and they're literally moving people in to dormitories there. We're not at that stage.
That's actually a great way to do it if you have a large number of people.
Well, they
to
unfortunately do have
identify
a large number of cases. That's the problem.
Right.
So, what, separate from the self-quarantine, what are the preparations that the county is taking to deal with, well, do you think it is inevitable that there will be an outbreak in County?
Based on what we're seeing so far happening across the United States and what's happened across the world, I will not at all be surprised if we have cases of COVID-19 or coronavirus.
So what steps does the county take to deal with that?
Well,
We just asked the superintendent about what happens if schools close, how they deal with stuff there. What would the county's responsibility? Because you would be the lead on this, am I correct?
correct. When it comes to a biological or health outbreak, county health departments act as the point. Our first course is to try and, of course, take care of the people who are ill, to try and mitigate its spread, and then to try and limit the number of cases. So we might have a person, we first need to identify if they are positive, so we'll help facilitate testing. And if that person is positive, we do our contact tracing. Who's that person been in communication with? And there may be other people, if they've interacted, who should be quarantined and watch for signs and symptoms of illness. We've been getting out the messaging about hygiene and good health habits, which are the same messages that we share at flu season all the time.
Which apparently now people are paying attention to where they didn't last year or any year over the last 7 years.
We laugh about that when, oh, there's no soap on the shelf. Well, didn't people wash their hands before? But
No.
I think people are
Is the
anticipating, right? People are anticipating. There are some opportunities depending on your workforce, depending on your school setting, depending on what other factors and interactions you do in the community, where you may work remotely, where you may study remotely. And so those are things that these work sites are working on, and the health department can only offer advisement at this point.
So there's also a lot of discussion nationally about testing. Are you doing any testing?
We are. When there are qualifying individuals and there are criteria for testing, physicians have the ability to screen out through questioning, assess the health needs of the individual, and then order an appropriate test.
And at this point, how many tests do you think you've done so far?
Performed one so far.
One so far.
Correct.
And is that one of the self-quarantined individuals?
So, yes, and once that person was tested, they then went under what we call mandatory quarantine.
And so they're under a mandatory?
Correct.
Okay. But that's not because they tested positive for it?
It is not. It's while we wait for results.
Okay. And do you have enough testing kits?
Right now, it's the viral testing kits that many doctor offices and laboratories keep on hand, so that's not an issue for us.
So one of your jobs, and you are as a public health educator and official, is to collaborate with others. So who else are you working with at this particular stage?
Well,
Maybe it's easier if I say who you're not working with.
You know, it's been really wonderful that the relationships we have had the opportunity to build over time really play well into communication now. So we certainly work with our State Department of Health, and we take guidance, but we also let them know what's happening boots on the ground. And because of that and the input from local health departments, they've changed some of their approaches to more practical. We certainly communicate with healthcare providers, and we've done that. We've been in communications with schools, including the colleges. We've had work sites call us for some advice. A lot of information is on our State Department of Health website. It's on our Centers for Disease Control website. And because this is such a dynamic situation, we are constantly going back and checking the Centers for Disease Control and Prevention site.
So what's your biggest worry today?
My greatest concern would be if we do get a number of cases, if there are people who are most at risk who contract that illness. Because it's been shown right now that if you are older or if you have underlying chronic diseases, that you are at greatest risk.
Heart.
Correct, and respiratory.
Respiratory. So I asked this only in light that obviously one of the largest outbreaks was in Washington State, and there was an issue with nursing homes. And
right.
Once it got in there, it tended to incubate, my word, not, I'm sure, the health departments. So are you having conversations with local nursing homes?
We've shared information, and the state health department works directly with nursing homes because they are regulated directly by them. So we're reiterating a lot of the same messaging that they're getting.
So for those who haven't, we were just talking about Dr. Torres on the Today Show, and he's on, at night. What are the symptoms in a basic way, as you know them?
As I understand them, it's very similar to the flu for people. So that's part of the screening and assessment process that needs to be done, is to rule out whether you have flu. So you may or may not have a fever. You may or may not have body aches. You may or may not have a cough. Same with diarrhea. Most cases that as I understand it, are feverish and a cough and body aches.
So last question on this, and then we'll get to what we really wanted you here to talk about, and that is, if someone thinks they've been exposed, they should not necessarily rush to the ER or their local doctor. Am I correct on that?
Correct.
What would you like them to do?
Well, stop and identify to yourself,
I
how do I
thought you
feel?
would say stop and think.
Well, it is think. Really, give pause and say, how am I feeling, or am I feeding into anxieties of what I have? Because I think that does happen sometimes.
But what if they think they have been exposed because they've been traveling, they've been on a plane?
That's
we
a
have
great
spring
question.
break. We have spring break for this college in the Auburn Large School District in about 4 weeks.
Right. So those might be legitimate reasons to be concerned. So you want to start with a health assessment. So that may be calling your doctor's office and saying, I'm concerned.
But they don't need walk-in. The worst thing
No.
they don't need, especially if you're going to a family doctor who sees everybody from an infant, a newborn, to a senior citizen.
Right. Your healthcare provider should be screening you on the telephone. Absolutely call in advance, because you don't want someone with any type of respiratory illness coming in and sitting in the waiting room. And so a lot of offices have their protocols to screen people over the telephone, and then, if appropriate, bring them right in to an office to be examined. If it's something emergent, you call 911. You don't wait. But most people probably can work with their healthcare provider.
Okay, let's talk about something a little bit lighter, maybe to a certain degree, women, infants, and children. So, for those who don't know what the WIC program is, and I would find it hard to believe, what is WIC?
Yeah, thankfully I think WIC has a really good brand. Our mission is to improve the health status of low-income women, infants, and children, and to help reduce the obesity rate. And to do that, we offer nutrition education, we offer breastfeeding support, breastfeeding education as well. We also offer a nutritious food package for our participants, and referrals to outside agencies as well.
So let's take them bit by bit.
Yeah, it's a lot.
So when you say to low income, is it only for low income? So what's the qualifier if you want to come and be part of the program?
Yeah, so our income guidelines are a little different than other federal programs. Right now we are 185% of the poverty level, which means a family of 4 could earn almost $48,000 a year, which is quite high for some families. So we are meant for working families as well. A lot of the times you're not expecting to have an additional baby in the household, so that puts a little bit of strain on the household regardless of how much you make. So WIC is really trying to help sort of bridge that gap for every family.
So do you have an idea how many women, infants, and children you see in a given year?
Our caseload right now is about 1,300 a month. Half of those are children between the ages of 1 and 5. The other half are between women and infants.
Okay. And when you, so I thought I saw some statistic that you all sent me. Was it 50% of the population of that? Go ahead.
So half of all infants in the U.S. Have participated in the WIC program. So that's a national level, which is quite a bit.
So how large a staff do you have at your office?
Yeah, let Stacey kind of talk about our nutrition staff.
We currently have 3 qualified nutritionists on staff. We also have a lactation consultant who's actually one of our qualified nutritionists as well. And we have 2 breastfeeding peer counselors as well on staff.
So you don't want, so let me hypothetically say I'm a woman who is in my 9th month.
Mm-hmm.
I should have come to see you earlier than that, correct?
Absolutely.
Okay, so tell me what steps should I be taking to utilize the services of WIC beforehand?
So, the first step is to get your nutritionist scheduled. And then once you get your nutritionist scheduled, we will So definitely, when you find out you're pregnant, reaching out to your healthcare provider. The healthcare providers here in Auburn have been really good about referring their patients to us. Once we get the participants in when they're pregnant, right away we're assessing weight, we're assessing iron, make sure there's no deficiency there, and we're giving them education, nutrition education, to ensure that they have a healthy pregnancy.
You all three mentioned weight several times. How big an issue is this? I mean, I know we have a national obesity issue, and we've had, and I think you were on many, many years ago when we had Reverend Humphrey here, and we talked about obesity and heart disease and all that. So it crosses all those paths. How big an issue is weight in women in pregnancy locally?
It's quite prevalent. So I don't have statistics with me currently, but we see quite a few participants that come into the program that are already overweight before they're pregnant, and that can perpetuate through the pregnancy. As nutritionists, we really need to provide them with education to just so, again, to ensure a healthy pregnancy, and with that meaning a healthy maternal weight gain, even if they come in overweight to begin with. And a lot of that really just entails what they're eating. There's a common misconception that when you're pregnant, you need to eat for two, and that's really not the case. A typical diet for a pregnant mom, as far as calorie-wise, is additional 500 calories per day. That's all they need to have a healthy pregnancy. Also, just encouraging physical activity. 30 minutes of physical activity a day can really help to encourage healthy weight gain during pregnancy.
And so you'll help outline all that
Oh,
for
absolutely.
them. So then once, so do you do Lamaze? Do you prep them, or is that something their gynecologist and their pediatrician get them ready for delivery?
Yeah, we would probably refer out for specific classes like that, but here in Cuyahoga County this year we're specifically targeting maternal weight gain. So we have, our goal this year is to help more women reach their weight gain goal, help it be within a healthy weight gain. So we are asking questions related to what they know about weight gain. We're asking if they do any physical activity. We're asking them to be part of this sort of study that we're doing internally at Cuyahoga County WIC, where we're giving pedometers and helping them set physical activity goals as well as weight goals. So that's something we're doing locally at WIC.
And what will you do with that data?
We'll look at it internally and see, did this make a difference? Is this something we should continue to do in the future? A big part of that survey is asking if the healthcare provider is talking about weight gain, because we want to know, is your OB helping you with this as well? Because we can't just do it alone here at WIC.
So now, go ahead. I'm
Well,
sorry.
I thought I would add on to the benefit of us having the WIC program here in Cuyahoga County is that it is housed in with the Cuyahoga County Health Department, so we have that additional supports from the Maternal and Child Health and Nurse Family Partnership Program that is part of the one big agency, and I think that's a benefit. Referrals go back and forth from WIC to Maternal and Child Health, so when you speak to maybe getting childbirth lessons, they might have clients who would qualify for one of our programs, and so our WIC staff will share that information.
So before I deliver today, when you provide services, is there any charge, or is there a sliding scale? Do you go to the insured? If somebody, I know this not often, but there are some people who have some basic insurance. How do you deal with the revenue side?
So there is no charge to be part of WIC.
Okay.
Nope.
So I delivered today. What is my next step with WIC?
Definitely give us a call
Okay.
and let us know.
So what are you doing for
delivered.
the infant, for the mom and the infant at this stage?
Yeah, so that first call to us, we'll sort of do a mini assessment right over the phone. How's breastfeeding going? Because we want to know how that baby's being fed. And then.
So on that particular front, no pun intended, on the breastfeeding front, you're encouraging all moms to get there.
Yes.
Do you have an idea of how many are successful after a week or 2 weeks?
Well, right now, the data that we have, about 73% of moms participating in the WIC program in Cuyahoga County have at least tried to breastfeed for the first few days of life. So that's
But how about getting over
huge.
that? Well, I know, but sometimes it doesn't,
Yeah,
a child doesn't latch, there's all types of other struggles along the way.
right. Right now, our data is about 25% of WIC moms
Okay.
get to the 6-month mark. So that's a good question, though, with that week. I don't have
But it's
specific
tough.
data for that.
as
It
you say,
is.
From that. So, you also, it's obviously women, infants, are you dealing anything with the infant on, not getting into the virus item, but vaccinations and all of those types of issues? Are those things that are covered through your office or a different part of the health department?
It's really both, and I'll let Tanya and Stacy speak to how they help assess families when they come in to visit. As you know, through the health department, we do have immunizations available. But what's wonderful is that's part of the visit that families have with your staff. Among the questions that's asked are what their immunization status is, and they can access the state immunization site to identify whether a child is up to speed on their vaccinations. They can also check lead testing if that's available. It's amazing the resources that WIC can provide and the referrals that they give to any number of agencies, not just within the county health department or county system.
So when you deal with someone, an infant, let me go back for a second. When you say children, to what age?
5.
Okay.
Yep.
So you also mentioned food kits. That seemed interesting to me. What do you provide there?
So the food package, which sometimes we like to call it a food prescription, it is a specific package tailored to that participant. So
give me both ends of the spectrum. What would one type of food packet be compared to another one?
Well, most have a lot of the same things. So children have whole grains, they have low-fat dairy, they have cereal, they have...
So are these samples or this to get them through week to week?
So this is a monthly food package that gets loaded onto their EWIC card, and they can go to any grocery store that accepts WIC, and they can buy the foods right there.
Does it impact their SNAP and other benefits? Is there an impact on their benefits?
It's a supplement to their
It's
benefits.
a supplement.
Yep.
That's
So it
the
doesn't
nice thing
hurt
about
them,
WIC. It's a supplemental nutrition program.
but it doesn't penalize someone
does
who's
not.
at a certain level of benefits.
It does not, and when Tanya and Stacy spoke about these food packages and the EBT cards, I personally am really impressed with how this has been implemented across the state within our county. Not only the vendors that participate and the women, and it's once upon a time when I worked in a grocery store and I was a checkout clerk, you had to look at the physical checks and you had to check to see if it was the right amount, and you had to say, oh, you're forgetting one item. Now it's so much easier.
Yes.
You really just get what you need at that time. You take your card, you swipe, and you go.
Nobody
It's
has
a
to
lot more
know.
convenient for
Right, but when you get this packet, you are given a list. It's not that you go to Wegmans and say, I'll take, packet 36.
No, it
Okay.
specifically has how much they can spend on fruits and vegetables, how much they have for their whole grains or the cereal or the juice or the dairy. We even have an app now, which is nice, so they can just check their app to figure out what they have left.
And if I met with Stacy and I said, I hate beans, don't put them on my list. Can I do that?
We have other options. It's a protein option. So say they don't like beans, we have peanut butter that you can have. So we tailor it to their needs.
But you mentioned beans, so I'm thinking iron in my own mind. So how big an issue is iron for you?
It's a big deal. Again, that's one of the things that we regularly check for with our prenatal moms and especially our children. Every year we check their iron to see if they're within a normal range. If they're not, we refer them to a healthcare provider and give them education on how to maintain or get back up to the status where they need to be for their iron.
So one of the reasons we are having you on for this particular one is this month recognizes WIC across the state. Am I correct on that?
Yes.
Recognizes nutrition.
Nutrition.
And WIC is
So what do you
very
have
nutrition.
planned for this? We have about 5 minutes left. What do you have planned for this month in Hugh County?
Yeah, so again, this month is National Nutrition Month, and it's a great way to promote and recognize and just have a discussion about healthy lifestyle choices. And the way we're doing that is really focusing on physical activity. That's a big part of it. and also just, again, having that discussion about ways to make small changes. And what I love about the theme this year for National Nutrition Month, the theme is Eat Right, Bite by Bite, and it really focuses or speaks to the ideal of just making small lifestyle goals and changes. And in the long run, it will make for huge changes in your overall health by just making small changes in what you do on a day-to-day basis.
So America loves trivia, so you're doing a trivia contest.
Yes.
How do you participate in that?
So every week we have a nutrition-related question. So when our participants come in for their appointment, they have the option to answer a question.
So give me a question.
One example, so this week, for instance, the question is, what is recommended for children under the age of 5? How much juice is recommended per day?
So I have no idea.
I thought you was going to
So
give
in
it a
my
shot.
house, there's lots of juice boxes, but I don't.
So typically, I mean, ideally, it
And
is.
by the way, if you answer this question, you're watching television, you would win
Yeah.
this week. So how much juice?
So, I mean, juice really is, we like to think of it as empty calories. It's a lot of sugar that's in juice. So anywhere from 0 to 6 ounces is what is recommended.
So
Ideally,
are you talking, when you talk about juice that way, are you talking about orange juice that you get out of the, because I see you in that aisle occasionally where we're getting the juice boxes, or juice bottles, simply fresh or whatever it is, or are we talking about high C and simply,
yeah, no,
the
there's
organic?
a difference. Mhm.
Okay, so what
We're-
ones are you talking about?
We're talking about a 100% fruit juice.
Okay.
Juice from 100% fruit juice. So the high C is really just high fructose corn syrup. It's not a natural sugar that's in there. You definitely want to go for the 100% fruit juice.
And so what does somebody win?
So if someone wins, so we have a gift bag that we've come up with, again, focusing on healthy lifestyle choices. So we have recipe books in there that have easy and fun and healthy recipes. There are pedometers that will be included as well, again, to really speak to the benefits of physical activity. Also, we have, within the community, we've had 2 businesses that have donated. So Champions for Life have donated gift cards for children to go and participate in their open gym on Fridays, which is
Okay.
really great. And we also have 3 Leaf Tea, which is here in Auburn as well, which has
In the
donated.
downtown
Yeah,
area.
they have the best matcha
Okay.
around. Yeah, so.
So what are they doing?
So so both have donated gift cards,
Okay,
so that we
so-
can provide to the participants if they win, if we draw their name from the
So
trivia
when
questions.
When you said, is it $1,300 a month or $1,300 a year?
A month.
Okay, so you have a staff of 5 or 6. How are you seeing that many
yes.
people?
Yes, well, that's a good question.
Sorry, I'm slow on the
busy.
math.
It's a
Yeah,
busy
we
office.
are busy all the time. And the appointments range from, a half an hour appointment to a 15-minute appointment to even an hour appointment. So not all appointments are very long once you're on WIC.
And you mentioned appointments. Can somebody just walk into your office, or do you ask them to make an appointment to come in? Do they have to fill out paperwork? What's it take?
Ideally, they would call us or fill out an application online at wicstrong.com. If you walk in, we might be able to get you in, but it's not guaranteed. So definitely calling ahead is the best way to do it.
But you don't, if somebody registers, you don't turn them away. This is, other than there's an, so what happens if somebody's over income? What happens in that particular case?
Yeah, it's a good thing, I guess, to be over income, but we really wanted them on WIC. But our approach is to first off double check, have another staff member make sure that they are over income, and then provide resources in the community. So we would definitely refer to the other programs in the county and in just at the health department even, to get them connected to other services that might be available to them.
And we should give your phone number out at least once or twice. So if somebody wants to set up an appointment, who do they call?
Yeah, they can call us 315-253-1406.
And is that just a screening call, or is that to set up an appointment?
Both.
Okay.
We'll screen and set up an appointment if appropriate.
And the number again is?
253-1406.
And this is for anybody in Cuyahoga County?
Yep. You don't even have to be in Cuyahoga County.
Okay.
WIC
You
is
have
a
to live in New
unique
York
program.
State.
Okay.
Yeah.
You
WIC
get-
is one of the few programs you can live anywhere in New York State
Yeah.
and go
Well,
to
we're
whichever
long and
program.
narrow county. Do you get
We
ones on either side of that? We have lakes that divide us up as
we
well.
do. We do.
Okay.
We get a lot from Onondaga County that comes
Spill
to
into here.
Cuyahoga County. Yep. Just
So
means
is
it's
there
closer.
local government support of this, or is it all state money?
The federal funds go through the state health department to the local WIC units. And in our case, we've been very fortunate that we've been able to sustain the program with the grant allotment that we've been given.
So without a local share on
Correct.
that.
And that's not to say that will always be the case, but we really work hard, and they're very clever about how we utilize our funds. And that is one of the benefits to being part of a government agency, that if things were a little short, we can say, don't worry about paying the rent this month. That
Right.
hasn't had to happen, fortunately.
Gotcha. So we do want to thank Cuyahoga County Public Health Director Kathleen Cuddy, Tanya Young, the County Women, Infants, and Children WIC Program Coordinator, and WIC Program Nutritionist Stacy Carter for discussing WIC. We'd love to have you back to do this without virus discussions or anything like that. But thank you all for doing this. And we'll, as we said, this was part of a public health discussion we're going to continue to have over the next couple of weeks. This may go into the fall. I know Ms. Cuddy is really looking forward to that. There's a lot of topics to talk about. We'll be back on Thursday with 2 Beyond the Front Page shows. The first one will be on Nick's Ride, and the second one on the Schweinfurth Memorial Arts Center. Both are recipients of DRI money. That's the Downtown Revitalization Initiative money from the state, and they have projects that are underway, and they have some fundraisers also coming up. We'll be discussing that. Next Tuesday, we'll have our third in a series of extended inside government interviews for the 24th Congressional District, this one with Roger Miso. We are working with the campaign of Congressman John Katko to have him in the studio as well. By the way, the Media Communications Department, Telecom Department here at the college is having their first ever Telecom Telethon on Wednesday, March 25th from 12 noon to 6 p.m. The telethon will be broadcast here on Spectrum Cable Channel 12, as well as live streamed on Media at Cuyahoga, the college's YouTube station. Performers of all kinds, I just learned between the break, of all kinds, you don't have to be a student here, are encouraged to participate, whether it's as a musical artist, a poet, stand-up comedian, or an actor or an actress, and want to do a reading. All the proceeds from the telethon will be going to the student food pantry here at Cuyahoga Cupboard, and we encourage you to participate in that. You can sign up or learn more about this by going to the college's website, or you can go to room T128 here at the college and sign up for this as well. We leave you with just a reminder, if you have any questions or thoughts for shows that you'd like us to have, or questions you'd like us to ask on Inside Government or Beyond the Front Page, you can do so at cozguytho@aol.com or Inside Government, 141 Dunning Avenue, Auburn, New York. I'm Guy Cosentino for the Cuyahoga Community College. We want to thank you for watching. Hope you have a good night. Have a great tomorrow. We'll see you on Thursday with 2 Beyond the Front Pages. Good night.